Yes, he existed in flesh and blood, although he assumed the complete appearance of a real phantom, that is to say, of the phantom of the Alpha.
The Phantom of the Alpha, of course, is the predecessor to Phantom of the Opera. Although the Phantom of the Alpha is slightly less well known, he's equally as menacing and dramatic. And of course, in this sketch of the Phantom of the Alpha, we'll be talking about drugs that modify the alpha receptors. Mostly antagonists, but some agonists as well. So please turn your cell phones off and take your seats. The show's about to begin. Recall from the epic summer camp scene that we reviewed the location of the alpha adrenergic receptors and went into some detail about alpha-1 agonists acting on sympathomimetics. In this sketch, we're going to cover mostly pharmacologic antagonist drugs whose major effect is to occupy alpha-1 and alpha-2 receptors outside the CNS and prevent their activation by catecholamines and related agonists. But first, however, let's light a few candles and descend into the dark, damp chamber of alpha-2 agonists, which, when given systemically, act centrally on alpha-2 receptors, reducing sympathetic outflow directly at the level of the brainstem. The story is this. You see Raoul here? Well, last night he heard Christine singing on stage, and while she was belting out those sweet, sorrowful high notes, he awkwardly starts singing along to himself, falling in love with her all over again, with his old childhood friend. The thing is, the Phantom of the Alpha Sorry about that. Anyway, the Phantom kinda already professed his undying love for Christine down in this creepy and absurdly damp underground lair. In a jealous rage, he traps Raoul down there. So Raoul is going to represent the alpha-2 agonist clonidine. The name is depicted by his gothic clonidine claw weapon. To remind you that we're talking about alpha-2 agonists here, not only is he brandishing 2 claws, but we also have him holding up 2 lit alpha candles to light up the dark, dank corridors. Recall that a lit alpha candle represents alpha agonists, while extinguished alpha candles will represent antagonists. As Raoul desperately searches for a way to escape, notice that, shrouded in darkness, there's this stairway leading from the stage down into the bowels of the opera house. The first stone platform in the lair is somewhat reminiscent of a wrinkled human brain. When alpha-2 agonists are given systemically, it's the central effects of alpha-2 receptors that predominate, causing inhibition of sympathetic tone and reduced blood pressure. So the story of the Phantom is a sad one. He was born with a face that not even his mother could love. He lives as a recluse in the opera house, and he conceals his disfigured face behind a mask for eternity. So, because of all of this, the Phantom longs for sympathy. Raoul, however, has slashed out the Phantom's message etched into the cold stone wall. So let the word sympathy crossed out remind you that centrally acting alpha-2 receptor agonists, such as clonidine, can be used as a sympatholytic in the treatment of hypertension. See those high-pressure steam pipes underneath the stage that power the Phantom's awesome stage tricks? Notice they're ready to burst? The Phantom, overreacting and being overly dramatic as usual, has threatened to use them to blow up the theater and everyone inside, unless Christine promises to become his bride. The classic bomb threat proposal. Pretty common way to propose to somebody during those times. High-pressure pipes like these, of course, are a recurring sketchy symbol for the treatment of hypertension. Clonidine reduces blood pressure by reducing sympathetic tone. This leads to a reduction in peripheral vascular resistance and also a decrease in cardiac output. And it looks like Raoul will have to act quickly because the pressure in the pipes has already reached an urgent level, as indicated on the pressure gauge above. So let this urgent warning remind you that clonidine is often used in cases of hypertensive urgency. Nothing much more urgent than the threat of blowing up a theater full of people. Another indication for clonidine is an attention deficit hyperactivity disorder. Slow or extended release preparations are effective in children with ADHD that's refractory to treatment with stimulants. At Sketchy, our symbol for ADHD is usually a very distracting HD television screen. I mean, look at Raul, the insolent boy, this slave of fashion. He's mesmerized by the Phantom's magical ADHD mirror. Centrally acting alpha-2 receptor agonists are also used as a first-line therapy for chronic multiple tics, or Tourette's syndrome. So take a look at your face in the Phantom's mirror. He's there, inside, controlling the erratic motor tics of this Tourette's marionette. Alpha-2 agonists, such as clonidine, are often preferred over neuroleptic agents because they're less likely to cause extrapyramidal side effects. Now, anyone who's made it out of the Phantom's lair alive knows to beware of the noose, the Phantom's signature weapon. When he's not hanging his victims from the opera house rafters, he also keeps his noose in his torture chamber for those unlucky souls who can't find their way out and instead wish to end their own lives. See, that's pretty thoughtful, actually. He's just misunderstood. So anyway, this rope is alpha-shaped to represent alpha-methyl-dopa, an analog of L-dopa. Our recurring symbol for all forms of dopamine is a dope rope, and in this case it's alpha-shaped, so you'll remember alpha-methyl-ropa. After being converted to alpha-methyl-dopamine and alpha-methyl-norepinephrine, it acts on those central alpha-2 receptors to lower blood pressure, similar to clonidine. And finally, we meet our soprano in distress, Christine, who holds up the 2 alpha candles and turns away in horror, realizing she's past the point of no return. No backward glances. Again, this stone platform behind her has cracks and grooves reminiscent of the sulci in a human brain. So this should help you remember that alpha-methyl-dopa is a centrally acting sympatholytic. And as with any centrally acting alpha-2 agonist, many of the side effects are due to CNS depression. We have this alpha-methyl-ropa positioned near the high-pressure pipes to remind you that it's used for hypertension. It was actually once widely used, and now it's primarily used for hypertension in pregnancy. So notice that Christine is pregnant with likely Raul's child. Just a minor detail revealed by Christine during her time with the Phantom, which only further fueled his jealous rage. A rare side effect to keep in mind is a lupus-like syndrome, so let's sketch in our recurring lupus wolf lurking in the shadows, trapping Christine inside the Phantom's chamber. The Phantom really did love Christine, and surprisingly, Christine got a tad creeped out when he took her back to his man cave, which happened to be a literal cave that was also extremely moist and depressing. Though he did clean up the place a bit, and even set up this surprisingly comfy chair for her, and he's lit 2 alpha candles next to it. A letter lay there, addressed to Christine, and inside he invites her, his angel of music, to stay with him forever. This letter to Christine symbolizes the drug tizanidine. So to Christine is tizanidine, another centrally acting alpha-2 agonist. Well, tizanidine is a muscle relaxant, so picture yourself relaxing in this Phantom's futile gift of an unexpectedly comfy reclining chair, and you'll remember that tizanidine is a centrally acting muscle relaxant. Alright, let's now turn our gaze above ground to the opera house stage, where we'll discuss alpha-1 and alpha-2 receptor antagonists. Notice that as we introduce each drug, an ominous cold draft summoned by the Phantom has extinguished the flames of the alpha candles, representing inhibition. Again, the drugs below are agonists of alpha-2, which has sympatholytic effects, and the drugs on stage are antagonists, hence the extinguished candles. Without further ado, the Phantom of the Alpha appears. Enraged that the opera house managers have cast someone other than Christine as the lead soprano, the Phantom has released the opera house chandelier from its hook, causing it to plummet toward the audience. Notice that the chandelier is comprised of both single and double candle holders with alpha-shaped wicks. Take a closer look and you'll see that where the Phantom is standing, the flames have been extinguished, and the Phantom represents phentolamine. And the extinguished single and double alpha candles mean that phentolamine is an alpha-1 and alpha-2 receptor blocker. We've previously discussed alpha-1 receptors located on vascular smooth muscle and their effect on increasing arteriolar and venous tone. Well, the alpha-1 antagonists we're about to cover will instead lower peripheral vascular resistance and blood pressure. In fact, a potent alpha antagonist, such as phentolamine, can even be used to prevent the depressor effects of sympathomimetic agents. This decreased vascular resistance is symbolized, once again, by these dilated floppy sleeves on the Phantom's outfit. Competitive alpha antagonists may reversibly or irreversibly bind to receptors, and while the phentolamine Phantom may reversibly appear and disappear back into the shadows, I want to mention one irreversible alpha-1 and alpha-2 receptor antagonist. On the Phantom's chest is a tattoo of a phoenix, a symbol of his impassioned desire to be reborn in the eyes of Christine, for she alone can make his song take flight. This tattoo of a phoenix represents phenoxybenzamine, an agent that covalently bonds to alpha receptors. The tattoo is irreversible. Phenoxybenzamine's binding is also irreversible, as opposed to the elusive phentolamine Phantom, who comes and goes quickly, vanishing without a trace. The effects of an irreversible antagonist may persist long after the drug has been cleared. In fact, with phenoxybenzamine, the restoration of tissue responsiveness to alpha stimulation may take several days as these new receptors are being synthesized. Alright, the Phantom is here to punish the opera managers for casting Carlotta as the lead soprano, instead of his love, Christine. One of the opera managers, as he witnesses this horrific apparition, drops his delicious mug of hot cocoa in terror. This face full of hot cocoa is our recurring symbol for cocaine overdose. Remember that alpha-blocking agents such as phentolamine can be given in cases of cocaine-induced hypertension, rather than, say, a beta blocker, which could cause unopposed alpha-adrenergic stimulation, leading to coronary vasoconstriction and end-organ ischemia. Recall from the summer camp fishing sketch that cocaine causes excess stimulation of alpha and beta-adrenergic receptors through increased levels of norepinephrine and, to a lesser extent, epinephrine. So let's go over two more clinical scenarios that involve increased catecholamines or catecholamine-like molecules in the circulation, where alpha antagonists can reduce pressure by counteracting widespread catecholamine-induced vasoconstriction. So see this little table set with aged wine and cheese to accompany the manager's sophisticated hot cocoa? Some foods, like aged wine and cheese, contain the sympathomimetic tyramine. Tyramine is usually metabolized in the GI tract by monoamine oxidase A, an enzyme that metabolizes serotonin and norepinephrine, while monoamine oxidase B, or MAOB, metabolizes dopamine. This mouse inhibitor represents MAO inhibitors, and if a patient is on an MAO inhibitor for depression, tyramine can distribute into the general circulation and cause a hypertensive crisis from all of this excess norepinephrine and epinephrine, while phentolamine can be given to block the alpha-mediated vasoconstriction. Now let's look at the second opera house manager, equally guilty in the eyes of the Phantom. And if you look closely, you'll see that he's not really screaming because of the horrific figure of the Phantom. He's actually screaming because of a horrifying brain freeze. See his delectable rainbow sherbet dessert? Let the occasional pangs of brain freeze remind you of the intermittent headaches of pheochromocytoma. Plus, in a way, pheochromo just sounds like a delightful, colorful frozen dessert. And in case you don't already know, pheochromocytoma is a tumor of the adrenal medulla that secretes catecholamines, especially norepinephrine and epinephrine. That's why we've made the top scoops of the dessert look like little adrenal glands. Symptoms of catecholamine excess caused by pheochromocytoma include intermittent headaches, hypertension, palpitations, and sweating, and this tumor can be seen on imaging. The irreversible alpha-blocking agent phenoxybenzamine, again remember the irreversible phoenix tattoo, is given days in advance to normalize blood pressure before surgery, but the shorter-acting and reversible phentolamine can be used intraoperatively in case of hypertensive crisis during surgery. All right, now it's time to move down to the stage where we'll find out what's in store for our opera singers. Well, if it isn't the lead soprano Carlotta, who's reviled by the Phantom, and she's shrieking in horror as she's trying to free herself from some sort of gothic torture device. Well, this tilt table should remind you of orthostatics. A common side effect of alpha receptor antagonism is orthostatic hypotension. This is because they block the alpha-1 mediated contraction of veins that's important for maintaining blood pressure in the upright position. All this dilation and hypotension leads to reflex tachycardia. This will be represented by this opera house doctor who rushes to her side and, looks like he didn't cover this in med school. What year is this anyways? 1870? Not much he can do with his bloodletting tools, so as a last resort, he falls back on what any of us would have done in times like this, a thorough and focused neuro exam. Notice that the reflex hammer is heart-shaped to represent reflex tachycardia that accompanies this orthostatic hypotension. All right, let's move on to the other opera singers who will represent the alpha-1 selective antagonists, and those are prazosin, terazosin, doxazosin, and tamsulosin. Notice that these drugs all end with O-sin, which are the first letters in opera and singer. So the O from opera and the S-I-N from singer. And notice that we've included a single extinguished alpha candle, our recurring symbol for alpha-1 antagonism. The opera singer here is hitting a pretty impressive A major, 2 octaves above middle C, a little out of his register. But this melodic scream at the sight of the Phantom is intensified by the sharp pain caused by this banister hitting him right in the prostate. Alpha-1 antagonists reduce smooth muscle contraction in the urethra and enlarge prostate, thereby relieving the urinary retention associated with benign prostatic hyperplasia. These agents, however, do not change the volume of the prostate. That's the job of agents that modify testosterone effects. See these loose, dilated sleeves? It's smooth muscle relaxation that you need to remember here. And since these agents inhibit constriction of vascular smooth muscles systemically, they're especially useful for patients with both hypertension and BPH. Looks like the loud crash of the chandelier is giving this O-sin opera singer flashbacks to his days in the Franco-Prussian War. And as he clutches his dog tags, he's praying for safety. The praying opera singer represents prazosin. And notice that the dog tags are labeled PTSD to remind you that prazosin has the additional use of treating some symptoms of post-traumatic stress disorder, such as nightmares and sleep disturbance. The classic side effect of these alpha-1 blockers is first-dose hypotension, involving an increased risk of orthostatic hypotension shortly after initiation of treatment. So remember this orthostatic tilt table up on the opera stage as a major side effect of these alpha-1 blockers. There's just one more alpha antagonist I want to mention before we bring this production to a close, and that's mirtazapine, an atypical antidepressant. The pharmacology of mirtazapine is pretty complex, involving antagonism of presynaptic alpha-2 receptors, symbolized by the extinguished double alpha candles, enhancing the release of both norepinephrine and serotonin. The name of the opera house, Mirth and Misery, should evoke the name mirtazapine, and the smiling mask should remind you of some of the happy serotonin effects that are involved, while the frowning mask should remind you that it's the treatment for depression. Alright, let's sum up the sketch. Under the stage, we have our alpha-2 agonists, which act centrally on alpha-2 receptors, reducing sympathetic outflow from the brainstem. Clonidine, represented by the claw-wielding Raoul, can be used to treat hypertensive urgency, ADHD, and Tourette's. Remember our motor tic-ridden marionette. The alpha-methyl-dopa rope, while terrifying, represents the treatment of hypertension during pregnancy. The surprisingly comfortable chair, lit up by alpha-2 candles in the back, represents the muscle relaxant tizanidine, for too Christine. Up above the stage, the phantom of the alpha extinguishes alpha 1 and alpha 2 receptors, representing the non-selective alpha antagonist phentolamine. This phentolamine phantom vanishes as soon as he appears, meaning that he's short-acting, whereas his permanent phoenix tattoo represents the irreversible alpha 1 and alpha 2 blocker phenoxybenzamine. These agents can be useful when treating states of catecholamine excess, including cocaine intoxication, tyramine-induced hypertensive crisis, and pheochromocytoma. All this vasodilation can cause orthostatic hypotension and reflex tachycardia. Our OSIN opera singers depict the selective alpha-1 antagonists useful for treating BPH and concomitant hypertension. The praying prazosin singer has additional benefit for patients with PTSD. And last but not least, mirtazapine, an atypical antidepressant and alpha-2 antagonist that can help turn your misery into mirth. But remember, when you down that delicious double scoop of pheochromocytoma, that's not brain freeze, my friend.
The phantom of the alpha is there, inside your mind.